Greetings everyone. You are watching Infovideopedia, where learning meets joy, with me, Shilpi Mahajan. Today let's talk about some of the key PK parameters, including Cmax, that's concentration maximum, time maximum, area under the curve, and we will talk a little more about therapeutic window. So let's get started. A typical PK graph is represented by concentration versus time graph. Y-axis represents the concentration of the drug. X-axis represents the time. As the tablet is ingested, it gets slowly absorbed into the bloodstream from the gastrointestinal tract. The concentration of the drug in the plasma rises from 0. It reaches a peak value, and the peak concentration is really called Cmax or concentration maximum. The time taken to reach concentration maximum is called Tmax or time maximum. In this curve, 6.7 nanograms per ml is the Cmax and 2 hours is Tmax. The shaded portion represents area under the curve or total exposure. Area under the curve represents the total amount of drug the body is exposed to over time. Let's understand how area under the curve is calculated. For educational purposes, we can divide this PK curve into different segments. Segment 1, 2, 3 and 4. Segment 1 represents the absorption phase where the drug slowly rises in plasma and it reaches a Cmax. This can also be represented by a right-angle triangle. Segment 2 represents distribution phase where the drug gets distributed into the tissues. It can be represented by a trapezoid. Segment 3 and 4 represent the elimination phase and they can also be represented by trapezoids. Area under the curve is the sum of all these areas, that's the right angle triangle and the subsequent trapezoids. Why is area under the curve important? Area under the curve is used to calculate bioavailability, that is the proportion of the drug that reaches the systemic circulation. Clast is the last measurable concentration of drug in the plasma. And Tlast is the time of last measurable concentration. It's possible that we did not take any samples after Clast, and hence that is the last concentration that we are measuring. In my last video, I talked about therapeutic window using dose as an example. Let me restate this. We use Tylenol or paracetamol as an example. We understand that the effective concentration is around 500 milligrams. If someone takes a 25 milligram dose, it's practically ineffective or it's a suboptimal dose. If someone accidentally takes a 10 gram dose, it's toxic. It can cause serious liver tox issues. Therapeutic window is a window of opportunity where the drug is both safe and effective. Now that we have learned concentration maximum, let's understand what's the relevance of Cmax and therapeutic window. In this illustration, 3 doses are represented. The Cmax in the gray represents the suboptimal or the subtherapeutic dose. It's below the minimum effective concentration and it might not cause any therapeutic effect. The curve in red represents a toxic dose because it's above the minimum toxic concentration. The green curve represents the optimal concentration because it is within the therapeutic window. It should not cause serious side effects and it should be effective. We are looking for a window of opportunity where the drug is both safe and effective. In this graph, in this illustration, we also understand the importance of Cmax. because Cmax helps us optimize the right amount of dose and the right route of administration. To summarize, therapeutic window is the range of plasma drug concentrations between the minimum effective concentration and the minimum toxic concentration. It's a window of opportunity where the drug is both safe and effective. PK parameters we touched today were Cmax, that's the concentration maximum, Tmax, time taken to reach Cmax is called Tmax, area under the curve representing total drug exposure. In the next video, we will cover some of the other important PK parameters like volume of distribution, clearance, bioavailability. So stay tuned. Thank you for watching.